Did you know some birth control methods work instantly, right at the time of sex, without hormones, prescriptions, or long-term effects on fertility? Let's uncover how barrier and pericoital birth control methods work, and which one might fit your needs. For pregnancy to happen, an egg from the ovaries must be fertilized by sperm. Barrier methods prevent this by creating a physical block that stops sperm from reaching the egg. The term pericoital birth control simply refers to any method used at the time of sex, including condoms, diaphragms, sponges, and spermicides. Have you ever wondered why condoms are the only birth control that also protects against infections? Let's find out next. Let's go through the main types of barrier and pericoital birth control used during sex. The first one is condoms. There are two kinds: external condoms for males and internal condoms for females. External condom is worn over an erect penis before sex. It prevents semen, the fluid that contains sperm, from getting into the partner's body during sex. Internal condom is worn inside the vagina and can even be inserted up to 8 hours before sex. It works the same way, creating a barrier that stops semen from reaching the uterus. To ensure that protection, always use condoms made of latex or polyurethane, as they effectively protect against sexually transmitted infections. Avoid condoms made out of natural materials such as sheep intestine. They may prevent pregnancy but not infections. Always use a new condom for each sexual act. And never use an internal and external condoms together. Using them together makes it very likely that one or both will break. Next we have diaphragm and cervical cap. A diaphragm is a flexible dome-shaped device placed inside the vagina to cover the cervix before sex. It's used with a spermicide, a substance that kills sperm, to add protection. The cervical cap works the same way but is smaller. It's usually not recommended for people who have given birth before, since childbirth changes the cervix's size and shape, making the cap fit less securely. The birth control sponge is a soft, disc-shaped device that already contains spermicide. It's inserted through the vagina before sex, where it acts as both a barrier and sperm killer, preventing sperm from reaching the uterus. Another one is spermicides, which are chemicals that kill sperm. They come in different forms, including foams, gels, creams, films, or tablets. They can be used alone, but are much more effective when paired with another method like a condom or diaphragm. A newer option is the vaginal pH regulator gel. Instead of killing sperm, it changes the vaginal acidity, making sperm unable to move. It's less likely to irritate the vagina or the partner's penis than traditional spermicides and can be used with condoms or diaphragms, but not with vaginal rings, which contains hormones. The effectiveness of these methods varies. In general, barrier and pericoital methods are less effective than long-term or hormonal options like intrauterine devices, implants, pills, injections, or patches. But when used correctly and consistently, they can work very well. Combining two methods, like a condom plus spermicide, increases protection significantly. Here's why many people prefer these options. They're safe and hormone-free. They don't change your menstrual cycle. Most are affordable and available without prescription. Fertility returns immediately after stopping. And condoms offer protection against sexually transmitted infections. Of course, every method has drawbacks. They're less effective than long-acting methods. They must be used every single time you have sex. Some, like spermicides, can cause vaginal or penile irritation. And some people find that condoms change how sex feels. So how do you choose? Think about your priorities. Do you want sexually transmitted infections protection? Can you remember to use birth control every time? Are you planning pregnancy soon? Your doctor can help you choose what fits your lifestyle and health best. If you forget to use birth control and have sex, don't panic. You can use emergency contraception. It works best the sooner it's taken. Some forms require a prescription. Others are available at pharmacies. And if you think you might have been exposed to sexually transmitted infections, contact your healthcare provider for testing or treatment advice. Barrier and pericoital methods may not be the most powerful at preventing pregnancy, but they're accessible, safe, and empowering options, especially for people seeking non-hormonal control or protection from infections. If you found this video helpful, hit like, subscribe, and turn on notifications for more clear, reliable medical education every week.